My name is B.G. Chandran. I'm a clinical psychologist and I have been working with children with learning difficulties for the past 29 years. Assessing children referred for learning difficulties is a very challenging task. We hope this video will provide the guidelines for clinicians and doctors who are given the task of assessing children with learning difficulties referred by the schools. This screening instrument is intended for children above the age of 6. This has to be supported by observations of the child's behavioral achievements in 4 main domains, i.e. gross motor, fine motor, speech and language, as well as personal social skills. This would provide a profile of the child's strengths and difficulties in each of the 4 domains and enable one to obtain an approximate developmental level of the child's status in the gross motor, fine motor, personal social and speech and language domains. We are now going to demonstrate how to perform the screening assessment on 2 children referred for learning difficulties. The assessment would involve the 4 main domains, i.e. the gross motor, the fine motor, the speech and language skills, as well as the personal social skills.
Assalamualaikum. Adam, apa khabar? Adam ya? Okay, Adam duduk. Encik, ini nama Encik?
Ahmad.
Encik Riza ya? Okay. Adam okey hari ni? Encik ada bawa dia punya senarai yang kita suruh bawa tu? Okey.
Terdapat 3 manual instrumen yang diguna oleh pihak sekolah dalam pengesanan murid bermasalah dalam pembelajaran. Pertama adalah manual instrumen pengesanan murid bermasalah dalam pembelajaran yang dikeluarkan oleh bahagian pendidikan khas. Kedua adalah manual instrumen senarai semak disleksia juga dikeluarkan oleh bahagian pendidikan khas. Dan ketiga adalah manual garis panduan pendaftaran orang kurang upaya itu OKU yang dikeluarkan oleh Jabatan Kebajikan Masyarakat. Instrumen ini perlu dinilai oleh guru dan perlu dilengkapkan serta disahkan oleh guru yang menilai. Instrumen saringan yang kedua adalah instrumen senarai semak disleksia ISD yang juga perlu diisi oleh guru dengan lengkap dan juga disahkan oleh guru.
Kat depan tu dah check lah semua yang barang-barang yang patut bawa kan. Barang instrumen pengesanan murid masalah, instrumen disleksia, dan juga untuk orang kebenaran lah untuk ni dan laporan ringkas guru. Ya. Encik faham kan datang sini untuk apa? Cek ada macam semua ya pasal dia kan ada buat ujian hari tu kan yang LINUS Tegal ni dan dia gagal lah nak ujian LINUS Tegal ya. Jadinya memang dirujukkan untuk kita tengok ada masalah lain dan sebagainya lah. Kita pergi ke sana kita nak buat ujian sikit. Boleh.
Learning Disability Assessment form should be filled up by the nurses, medical assistant and also doctors. There are 10 components that should be assessed during the consultation and examination. The examiner should enter the patient's name, gender, date of birth, age, and assessment anthropometry should be done by the nurses or medical assistant.
The gross motor skills are abilities required in order to control the large muscles of the body for walking, running, sitting, crawling, and other activities. Motor skills usually develop together since many activities depend on the coordination of gross and fine motor skills. Gross motor skills develop over a relatively short period of time. Most development occurs during childhood. Children reach developmental milestones at different rates. School-age children are quite skilled at controlling their bodies and are generally good at a wide variety of physical activities, although the ability varies according to the level of maturation and the physique of a child.
For gross motor assessment, we are going to do a few activities which include jump on both feet, run and kick the ball, balance on one foot, heel to toe walk, and also crouch on tiptoe. Jump on both feet.
Kita akan lompat dengan dua kaki kiri ke atas. Sini.
Observe the way the child jumped and look at the arms and the knees. In Adam, you can see that there is some incoordination of the arms and legs, and he did not bend his knees, and he's more of stomping rather than jumping. As compared to Alif, where he actually jumps with both legs off the ground and also he bends his knees properly. Run and kick the ball. Ask the child to run and kick the ball. Observe the way the child runs and kick the ball. Observe the way that Adam runs. He was having problem in coordinating his running and kicking the ball. There was some hesitancy when he wants to kick the ball. As compared to Alif, where he actually runs and kicks the ball smoothly in coordination.
Five to 7-year-olds can skip, jump, rope, catch a bounced ball, walk on their tiptoes, balance on one foot for over 8 seconds. Many can even ride a small 2-wheel bicycle. 8 and 9-year-olds typically can ride a bicycle, swim, roller skate, jump rope, use garden tools, and play a variety of sports.
Balance on one foot. The child was asked to stand on one foot for at least 10 seconds. Observe the arms and the legs movements. In Adam, we can see that his arms are not in the straight line, and he actually hooked his leg to the other leg for balancing. In Alif, we can observe that the hands are in balance, and he was able to count until 10 seconds.
There are a range of disorders that affect gross motor skill development. Genetic disorders, muscular dystrophy, cerebral palsy, developmental coordination disorder, and some neurological conditions adversely impact gross motor skill development.
Heel to toe. Ask the child to walk on a straight line Ensure that there's no gap between the heel and the toe during walking. Observe the way the arm swings. In Adam, we can see that the child has problem in keeping his arms in balance and also while coordinating his heel to toe walk. In Alif, he also have difficulty in making sure there's no gap between the heel and the toe, and have some difficulties sometimes in balancing his arms. Crouch on tiptoe. Ask the child first to tiptoe and subsequently crouch down. Observe Adam. He is unable to tiptoe and subsequently crouch. He would balance himself using his hands. Alif can tiptoe and crouch, but having problems at times in balancing himself in that position.
Fine motor skills involve the small muscles of the body that enable functions such as writing, grasping small objects, and fastening clothing. This involves strength, fine motor control, and dexterity. By the age of 5, most children have clearly advanced beyond the fine motor skill development of the preschool age. They can draw recognizably human figures with facial features and legs connected to a distinct trunk.
In fine motor assessment, we are going to observe the way the child holds the pen and writes. Adam has a mature tripod grip.
This is what Adam did when I asked him to write his name. When I asked Adam to write the alphabet, this is what he wrote. It's very difficult to differentiate what actually the alphabet except A, C, D, and the sequences is all wrong.
Nama dekat sini. Tulis. Nama dekat sini. Alif has a mature tripod grip. But we noticed that the child is actually putting pressure while writing. This is a sample of the patient's handwriting. Observe the patient's handwriting and also the way he writes the numbers. You can see that the numbers are there's no gap between the numbers to indicate that there's a problem with some visual spatial problem. And we asked him to write the alphabets. He can only write A, C, and D, and then there's a mixture of capital letters and the small letters.
Fine motor skills are important in most school activities as well as in life in general. Fine motor difficulties need to be addressed and referred to an occupational therapist for intervention. In summary, both gross motor and fine motor are important in a child's learning, both academically as well as in social play and games.
Throw and catch the ball. Ask the child to throw and catch the ball. Observe the way the child throws and how he catches the ball. In Adam, we can see that he is having problem in catching the ball, where his arms are in fixed position. When he was throwing the ball, we can observe that he actually cannot aim the ball properly towards the catcher, that was Alif. As compared to Alif, where he can do that smoothly. In copy the shape test, the child is shown the drawn shape and then we ask the patient to do the same shape, that is to copy the shape. So this is actually the patient's copying and this is the actual age group.
Copy the shape test. This is what Adam did. He can copy the circle, the cross, a little bit of a square and a triangle. He can't actually do a proper diamond. So the equivalent mental age is around 5 years old.
So in this patient, we can see that the child can draw a circle, a cross, a square, a triangle, and part of the diamond, which is around 6 years old. So as a conclusion, the child age is around 6 years old.
Speech and language development is a useful indicator of the child's overall development and cognitive ability and is related to school success. Children presenting with speech and language delay may have an increased risk for learning disabilities. They may have difficulty reading, exhibit poor reading skills, and have difficulty with written language and reading comprehension. The examiner should try to obtain further information from the parents or caregivers to verify and determine the approximate level of the child's language and communication skills. Furthermore, if language is delayed, one has to establish the level of severity and how this is affecting the child's ability to communicate with his family, peers, and teachers.
Observe the way the children spell and read. Give your comment.
Buku best. Kita tengok nak buku ni. Okay, alright. Ni apa ni?
Api.
Cuba je dia.
G-A-P-A-R-E-E-A-P-R-P.
Child 1 have difficulty in recognizing alphabets, unable to read. He sometimes guessed the word according to the picture shown. Sekali kuat-kuat. Child 2 seems to be able to recognize alphabets and able to spell certain words. However, Notice that he also have some picture recognition that doesn't tally with his spelling.
Speech and language development is a useful indicator of the child's overall development and cognitive ability and is related to school success. Children presenting with speech delay may have increased risk for learning disability. The children may have difficulty reading, have poor reading skills, have problems with writing and reading comprehension.
Observe the way the children perform sequencing tasks. What have you observed?
Gosok gigi. Okey. Ni ada banyak gambar ni, ada 5. Boleh tak Adam susun? Mana nombor 1? Mula sekali. Ni nombor 1. Okey, letak dekat tepi sini. Depan sekali sini. Okey. Lepas tu? Yang mana lagi? Ni. Okey. Ni mula-mula dia dah gosok gigi ya. Okey.
Child 1 needs lots of prompting and seems unable to tell stories.
Yang ni. Okey. Nombor 4? Ni. Nombor 5? Ni. Okey, betul macam ni. Ni nombor 1. Mula-mula dia gosok gigi. Betul? Betul Dia nak ubah apa-apa? Tanah. Okey.
Sendiri. Okey, doktor nak bagi gambar, kita nak susun macam mana cara nak basuh kasut. Okey. So pilih yang mula-mula, yang mana kita nak ambil. Macam mana tu nak basuh lepas kasut kita kotor. Alif susun. Ambil susun kat situ. Okey, lepas tu antara yang ni. Okey, lepas tu berus lagi. Lepas tu yang mana? Yang ni apa? Jemur kasut yang ni? Basuh. Okey, yang ni dengan ini mana dulu? Ni dulu. Okey, yang ni. Kemudian, okey, yang ni. Lepas tu, antara ni yang mana dulu? Antara kapur ke jemur dulu? Jemur dulu baru kapur. Okey. Betul macam ni. Child 2 was able to do the sequencings and able to tell the story of the task. However, he needs also lots of prompting and his sentences were short. Cuba cerita. Mula-mula. Mula-mula buat apa? Lepas tu? Dia tak gosok lagi, dia letak apa? Macam mana? Lepas tu? Bak gigi letak di? Tu gosok gigi. Lepas tu? Kumur-kumur. Lepas tu? Lap. Okey, pandai.
One method would be to look at the child's ability to tell stories. Use storybooks or pictures depicting people and animals performing various tasks or actions. If the child is communicative, the examiner can encourage the child to talk about his or her likes and dislikes, describe a holiday, talk about their pets, hobbies, favorite movies or TV programs. There are so many things one can talk about.
Observe the way the children tell stories from a picture.
Apa cerita? Apa cerita dia? Cuba Adam cerita sikit. Apa? Tanah. Okeylah.
Child 1 needs lots of prompting, but only single words were heard. However, the words are only at the end of the word.
Senang sikit. Dia yang jual lah. Ya. Orang ni? Hati.
The examiner have difficulty in recognizing the words.
Awang. Apa dia?
Awang.
Orang. Beli bawang. Okey.
Yang ada ujung ni.
Yang mana bawang? Cuba tunjuk kat doktor mana bawang. Siapa yang beli? Siapa? Ni. Dia ni beli.
Dekat pasar. So ada apa kat pasar? Orang tengah buat apa? Child 2 was able to tell stories, but however his sentences are short and also needs a lot of prompting to tell the whole stories. Lagi. Lagi dia jual apa? Apa tu?
Engaging the child in conversation is a good way to assess as well as to obtain a sample of the child's ability to use words and sentences to communicate, ability to use the appropriate grammar, nouns, pronouns, verbs, tenses. The clinician needs to observe various aspects of the child's expressive language, such as fluency in delivering the information, whether the child requires prompting or has difficulty searching for appropriate words or has insufficient vocabulary and so on. The examiner is also advised to assess the child's verbal comprehension either by asking questions relating to the pictures and providing a simple instruction consisting of 2 or 3-step commands.
Observe the way the children respond to the instructions given.
Cuba Adam tunjuk yang mana satu bola warna biru. Okey. Sekali. Cuba Adam ambil bola warna biru. Cuba pegang bola warna biru. Okey. So, alright. Adam dengar doktor cakap ya. Okey. Cuba Adam ambil bola warna...
Child 1 only able to respond to 1-step command.
Ambil bola warna kuning. Bagi dekat ayah.
Sekarang doktor cakap lain tak? Ambil bola kuning, letak bawah kerusi. Letak bawah kerusi. Alif. Doktor cakap, tendang bola warna merah. Lepas tu bagi pensel dekat doktor. Ambil bola merah, tendang. Lepas tu bagi pensel dekat doktor. Tak dengar doktor cakap lagi sekali. And child 2 was able to perform 2-step commands but have difficulty in executing the 3-step commands. Siapa?
To assess personal social skills involves the child's ability to provide personal information such as name, age, gender, and other relevant information pertaining to the self, such as name of school, name of family members, and friends. Secondly, to perform various living skills independently, such as feeding self, dressing, toileting, and so forth. The third area is the ability to communicate and interact socially with children and adults at home and at school, as well as engage in games and activities appropriate for the child's age.
Observe the way the two children performing the task. What have you observed? Child 1 was noted to have difficulty in lacing the shoes, and also he is also noted to have difficulty in tying up the knot. As compared to child 2, he seems to be able to do the task without any difficulty. Observe the way the two children performing unbutton and button up their shirts. What do you observe? In child 1, he did not concentrate on his task. and he was noted to have difficulty in unbuttoning and seems to be struggling when doing buttoning up. As compared to Child 2, he had full concentration on his task and have no difficulty in completing the task of buttoning and unbuttoning the shirt.
The clinician is required to assess the child's proficiency in executing the activities of daily living by direct observation of some of the skills, for example, buttoning, tying shoelace, putting on shoes, etc. Other relevant information such as toileting, bath routines, dressing can be obtained from the interview with the child's parents and caregivers. Throughout the screening assessment, the clinician should record the child's verbal and non-verbal social skills. Verbal skills include observing the child's ability to use language in a socially appropriate way, example, tone of voice. Turn-taking, ability to initiate, maintain and terminate a conversation. Non-verbal skills include observing the child's eye contact, gaze, sustained attention, ability to focus during a given task or activity.
Cognitive development is development of the ability of the children to think, understand and reasoning. This is the development of the learning structures and systems in the brain that begins at birth and continues throughout adulthood. This includes the construction of thought process such as memory, problem solving, exploration of objects, concept, attainment, etc. In school-age children, they should be able to concentrate for a longer period of time in set tasks, enabling them to think, understand and find reasons to simple problems. They should have greater understanding of a variety of concepts, and memory also improves dramatically. They will also start to have their own thought process and curiosity begins to emerge. They begin to discover answers to some difficult questions, such as where do we come from and how we were born. At this point, child absorbs information with ease and attain a wide range of knowledge when being exposed to. Some of the tasks that can be done to assess cognitive development include good enough draw a man test, counting forward and backwards from 20, knows left and right competently, identify days of the week, months in the year in chronological order, and understands and begins to tell the time. They will also able to follow and understand complex instruction, verbal and visual, at the age of 7 to 8 years. In the good enough draw a man test, the examiner will ask the child to draw a man. We want the child to draw it carefully, the best way that he knows how, and also to take his own time. The child will receive 1 point for each of the items which are present in his drawing. Do not include the face, that is the circle. Use the formula given to calculate the age equivalent, that is the mental age.
Bakin.
In a good enough draw a man test, this is what Adam did. If you can see, there's a face and 2 eyes, a trunk, a pair of hands and a pair of legs. It's equivalent to around 5 years old.
rambut dia. Okey. Wah, rambut dia. Ni rambut pasien terkini. Rambut cacat In this patient's drawing, we can see there's a presence of the eye, nose, mouth, ear, hair, neck, arms and legs that are firmly attached to the right point, and also the length of the trunk is longer than the breadth of the trunk. So the total, the mental age group for this child is around 6 years old. The two children seen in the video were real students that have been referred to the doctors for failing or for being LINUS tegar. They have not been seen or assessed by any doctors before, prior to this filming. After viewing the children performing the tasks in this video, now discuss the probable diagnosis of child 1 and child 2. Give your reasons for your diagnosis.
This is a learning disability assessment tools that should be filled up by the assessor. First part should be filled up by the nurses or by the doctors. The second part should be assessed by the doctors, well, good history taking from the parents and also teachers. Physical examination should be done by the doctor. Developmental and cognitive assessment also should be done by the doctor. Assessment of gross motor according to the age, 5 years, 6 years, 7 years, 8 years and 9 years. Activity of daily living, shapes, then we assess fine motor, pencil grip. We assess cognitive, good enough, draw a MEN test to assess patient mental age. Cognitive reasoning, assess speech and language in 2-step command and 3-step command. We also can refer the LINUS screening tools done by the teacher by identify problems from the LINUS instrument. Our main concern in terms of assessing identification of problems from the LINUS instrument, we use items number. For example, intellectual disability or mental retardation, item number 7, 8, 9, 11, 12, 13 and so on until 31, most probably the student have intellectual disability if the answer is yes to these items. And same goes to autism, ADHD, specific learning disorder, and last but not least, coordination problem. Then we proceed another tools, instrument senarai semak dyslexia, whereby the student will bring along this assessment tool that been done by the teacher at school, and it should be signed by the teachers that assess the student, and from there they will put the score. If the assessment done by school showed the score 1, 1 at this level, code 1, 1 and 1 showed that most probably this student have a problem of dyslexia. The next part, we also assess the student in terms of social and behavior aspect, whereby we look into the student strength and also weakness. We also assess the comorbidities, other problem that the student have. The last part is our impression and differential diagnosis, whereby we find out what is the type of disability that may occur in the student. After the assessor have examined and assessed the student, the assessor should sign and chalk their names.
After you have come to a diagnosis, now it's time to break the news to the parents. Watch these video clips and discuss how would you handle the situation, 1 and 2, yourselves.
Cik Di pernah dengar tak yang kanak-kanak keluhan khas ni? Sebab selalu ibu bapa dia akan dia pernah dengar nama macam OKU lah, macam kurang upaya.
Doktor, saya macam tak percaya je lah anak saya OKU. Betul ke? Boleh cek tak lagi sekali nak pastikan
Okey.
betul ke tidak dia?
Yang mana satu tu yang Cik Di rasa?
Yang OKU tu.
Yang OKU
Ya.
tu lah.
Setelah membuat penilaian, kami berpendapat anak Encik mengalami masalah pembelajaran. Beliau memerlukan pendaftaran sebagai orang kurang upaya untuk tujuan ini.
Apa yang kurang upaya dia tu?
Jadi itu mesti ada salah seorang daripada ibu ataupun ayah yang...
Saya dah beritahu doktor, dalam keluarga saya tak ada yang OKU. Apa doktor? Balik-balik OKU, balik-balik OKU. Kamu tak dapat? Ha? Kenapa tak dapat? Kena bimbang tu risau. Benar tak doktor?
We sincerely hope that this video would be beneficial to help the clinician in assessing children with learning difficulties. It is only meant to be a guideline, and we encourage you to use your clinical judgment and conduct other necessary assessments as required before making a decision.